Pelvic floor problems, bladder weakness, we as doctors call it stress incontinence, which is an awful phrase. It's just your pelvic floor is weak, therefore your bladder leaks when you strain yourself, when you cough, when you laugh, when you sneeze, when you jump up and down. Any strain causes the bladder to leak.
The pelvic floor is vital to a woman. In my mind, it's the core of a woman's body. Pelvic floor should be nice and taut. As we get older, with childbirth, heavy birth weight babies, pelvic damage, any sort of pelvic surgery, that muscle can weaken and so it bows, and so all the organs then push together. Sometimes you can have prolapse, pelvic pain in women. So it is vital for us to look after our pelvic floors. I think it's one of the most ignored muscles in a woman's body.
I never realised exactly how much your pelvic floor muscle does, or indeed how big it was. To me, the pelvic floor muscle I thought was like two muscles about that size. You know, looking at the model, you're talking about a good cappuccino cup. It's about that big, and it's got to support a hell of a lot of weight.
When you've had a pregnancy, you've got the weight of that growing baby on top of the internal organs, you know, stretching the muscles. Then you have the trauma of the baby going through the birth canal, through the pelvic floor muscles, you know, tearing them and damaging them. And of course, every subsequent pregnancy, you know, adds insult to that injury. And then of course, when you get to the menopause, your estrogen levels are dropping and you lose the elasticity and the tone of those muscles.
The birth weight of our babies is increasing, so when everybody says, "Oh, I've just had a 10-pound baby," and you go, "Yeah, great," what you should be saying is, "Wow, that's been a lot of pressure on the pelvic floor. This woman is potentially going to have a problem."
About 42% of women under the age of 50 have this problem, pelvic floor problems, bladder weakness. And, you know, they don't come to see the GP. You know, when they get these problems, most women suffer for about 5 years before they actually pluck up the courage to go and see the GP. So they're not telling the doctor, they're not even telling their partner, they're so embarrassed.
Pelvic floor, for obvious reasons, and talking about it is quite a sensitive issue for an awful lot of girls. It's quite an embarrassing topic to breach, even with a personal trainer where you're working with people within their confidence. You can obviously notice things when you get certain ladies to run on the treadmill or to take them out, or when they're doing specific exercises such as step-ups, needing to nip to the toilet and things like this. So you can see a weakness.
We need to talk more about this, and we need to face it as a problem and not feel embarrassed and say, "Hey, yeah, well, actually, that's me. Yeah, I do suffer a bit. My pelvic floor isn't as good." I don't know why it's a taboo. I wish that more women could be honest with themselves and to seek help.
It was only when my daughter got older and I was running around after her, picking her up, that I noticed that I was leaking, which I wasn't sure if it was to do with the birth or what it was about, or just tiredness. And it wasn't until I saw an article in a magazine, you know, telling me that actually I'm not alone. You know, most women in their lifetime will get it of some description.
And it almost becomes a normal way of life. It doesn't have to be normal. A normal way of life should be a fit, healthy pelvic floor muscle that keeps everything in check, and then you won't have any further problems.
The best way to treat pelvic floor problems, bladder weakness, is really to exercise your pelvic floor muscles. Like any muscle in your body, if you don't use it, you lose it, and don't we know that as we get older?
A lot of people don't realise how to work their pelvic floors correctly, or the rest of their core musculature. So what can happen here is the muscles can become inhibited by pain or lack of use or shock value. The body's just not used to being used.
The pelvic floor can be exercised quite easily, quite simply. There's lots of devices out there to help, and of course the Athena is one of the best, I think, because it's cordless. And the thing with any stimulation device, because these devices work the same as TENS machines, which help with pain relief, is they work deep within the muscles and they give you a far deeper, more effective exercise than you can by sitting there and doing your manual pelvic floor exercises for 25 minutes.
Because the Athena's cordless, it's very discreet. You know, I can put in the probe in the toilet, the downstairs toilet, and go back and sit on the sofa and have 15 minutes of my exercises being done, and my husband doesn't know what's happening. You know, so it's not something that where I have to sit there and find the time and potentially have the embarrassment that someone's going to walk in on me and there's cords or bits hanging outside. It is totally discreet.
The probe stimulates the muscles, the right muscles, in the right way. So the exercise you're having is actually working on the muscles that need strengthening and working on them in the right way, so they're contracting, getting stronger and stronger. And this involves just 15 minutes twice a day.
My friends have all noticed a difference. I'm running around after my daughter a lot more. I'm jumping on the trampoline. I'm going on long shopping trips. And people ask me, you know, what's happened? And I tell them about Athena.
If you want further information on the pelvic floor problems, how to do these exercises correctly, and treatments that you can use yourself, you could go to my own website, which is the Family GP, or one word, thefamilygp.com.
The Athena is great. You pop it in and it does the work for you, so you know that you are getting 100% of the exercises all the time because it's doing it for you and it's taking out that human error.